Welcome back, everyone, to NeuroAlchemy, where science meets soul and where healing becomes multidimensional, intuitive, and profoundly possible. I'm your host, Dr. Sarah Young. Here on NeuroAlchemy, we define every term as if you're hearing it for the very first time, because clarity creates safety, and safety opens the door to new healing possibilities. Today, I'm joined by Kimberly Diaz, a registered nurse, dementia care advocate, educator, and trauma-informed leader whose work bridges nervous system science, caregiving, embodiment, and deep human compassion. Kimberly's story is one of transforming early caregiving, chaos, and survival into grounded leadership and intentional healing. And she brings that wisdom into how we care for ourselves and for others in life's most vulnerable moments. Before we dive in, I always like to begin with a gentle arrival check-in. Kimberly, how are you arriving today, either physically, emotionally, or energetically, as you come into this conversation?
I feel very centered today. I'm looking forward to this and I'm feeling very good.
Wonderful, wonderful. That's what I love to hear. And before we go deeper into your story, I'd love to start by grounding a few key core concepts and terms that we'll be returning to throughout our show today. For our listeners, how would you define trauma? Trauma not just as an event, but as something experienced and stored in the nervous system.
Well, trauma can be little, it can be big, and our nervous system, unfortunately, doesn't know the difference if that was a big trauma or if it was a little trauma. And our bodies will often react like it was that huge trauma in times that's inappropriate and cause us to react instead of respond in situations that it's not really, we don't need it to protect us anymore. So really being able to recognize that awareness for me has been huge, and just understanding, recognizing it when it comes and talking to myself sometimes, and letting my body know I'm safe, you are loved, I've got you. Talking to that little girl that was very wounded.
I understand exactly what you are describing. When people hear the word dementia, there's often a lot of fear and confusion. How would you explain what dementia actually is in clear everyday language?
So I often talk, so I call dementia brain changes because that's really what it is. And a lot of the seniors, or even not seniors that I work with that have dementia, don't like the word dementia. So we often just call it brain changes, because that's exactly what it is. And generally, those changes are happening. You're doing that damage decades before you actually get that dementia or that Alzheimer's or that Lewy body diagnosis. So it's really brain changes and things that are happening neurologically, which then cause physical symptoms and loss of abilities.
And how might you help our listeners understand the difference between Alzheimer's disease and dementia in a more broad sense?
Yeah, so, I always refer to, as many do, dementia is more of an umbrella term. And under that is, Alzheimer's, vascular dementia, Lewy body dementia, frontal temporal lobe dementia, vascular dementia, and most commonly really is mixed dementia. And from what I understand, there's actually been over 120 different types of dementia that have been identified. And so Alzheimer's dementia is the most common dementia, and it can last for a decade or more. People can be diagnosed with it. I've had clients that have been diagnosed in their late 30s with early onset Alzheimer's dementia. And then sometimes they're not diagnosed until, their 80s or 90s or 70s. So it really depends on their, particular case. But I definitely believe there is power in knowing what type of dementia you have to help plan for your future, to help your family prepare, not only emotionally, but financially. Where are you going to go? How are they going to take care of you, to help with some of that fear? And there's also a lot of stigma, which is something that I'm really trying to help eliminate that stigma. People with dementia should be able to be out at grocery stores, be able to go out in restaurants. Their families shouldn't have to feel like they have to isolate them at home almost in shame because of how they might act when they're out in public. That really breaks my heart.
And can you define embodiment, especially in the context of caregiving, chronic stress, and prolonged responsibility?
So, embodiment to me, a big part of embodiment is just being present. Meaning, I own a home care company too. And I tell the caregivers, put down your phone, put down, anything that's going to distract you and be present in the moment with your person. Listen to their stories. In meeting them where they are, if they think it's 1952 and they're waiting for their dad, be there with them. Get curious with them. Ask them about that. What are you excited about when dad gets home? Let's talk about dad. Let's look at pictures. I mean, there's nothing wrong with that, but meet them where they are because that's their reality. So just really embodying that moment, having gratitude for it, and just being in the present. And we're so easily distracted, whether it's the phone or the TV or whatever it might be, really taking that time and being present in the moment.
Yeah, a lot of people that are having family members with dementia, I see this in my clinical work, is they want to tell them like that's not happening, that's not real. And I often have to tell them like that's one of the worst things that you could be doing because you're going to split their reality and there's nothing that you're going to be able to do to change the way that their brain is experiencing reality. So it's always better to join right in, right? Is to find them, meet them where they're at, and so I love that you shared that. Can you define self-compassion and why it's so often misunderstood as a weakness rather than a nervous system skill?
Well, you can't fill from an empty cup. And you have to, just like the person that you're helping with dementia, how you have to realize they're doing their best, you're doing your best too. And you're not gonna do the perfect thing or say the perfect thing every time, but give yourself some grace and some forgiveness, just like you would somebody else. If you make a mistake, well, own it and move on. Have love for yourself. You're doing the best that you can. It's easy. We're definitely our worst critics. So if we could just have the same compassion for ourselves that we have for others, it goes a long way. But that takes practice. I've really just over the last several years really understood that for myself. I've been a nurse for 27 years. And before that, a caregiver for my mother and for my siblings and so it was always give, 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 and always put yourself on the back burner and almost looked at self compassion as selfish. And it's not. It's not at all. You have to take care of yourself first before you can take care of anybody else.
I couldn't agree more. You're absolutely correct when you say you can't give from an empty cup. Another way of saying that is, you could to take care of ourselves so that we can help take care of others, right? Because if we're in a depleted state, if we're in a state where we're frazzled or we're upset or we're not eating or we're not sleeping, these are all very common things that caregivers have told me also. You're not going to be able to give that individual you're caring for your best. And you really want to give them your very best. So that's what makes it not a selfish thing. It's actually
Right.
very selfless to take care of yourself first so that you can give 1,000% to those you care for. Kimberly, finally, our last term that I would love for you to describe for our audience, nervous system survival mode versus regulation. What's happening internally when someone is living in each of those states?
Well, you're parasympathetic. That's your relaxing. That's your rest and digest. That's your feeling calm and you're feeling good. Vagus nerve is helping you out and all things feel well. And then you've got your sympathetic, which is your fight or flight, which unfortunately most of us live in a lot of the time, which long time ago, that's what we needed to survive. So, if we were being chased by that saber-toothed tiger, but we're no longer being chased by that saber-toothed tiger. So we need to really retrain our nervous system So box breathing, meditation, going for walks in nature, have a morning practice and every morning, and I get up personally at 4:30 because that's what time I need those 2.5 hours to take for me. And that's meditation. I love and I've been to and I follow Dr. Joe Dispenza. I meditate, I journal, I do my sauna, my infrared sauna, I exercise. I take 2.5 hours every morning to fill up my cup so that I can give to others. And breathing, I always do breathing exercises too. So breathing, something that we have to do, we must do, but we take it for granted. I mean, there's times you get stressed, go in the bathroom, take a few 5, 6 nice deep box breathing. I mean, it goes a long way to just kind of reset yourself and come out as a new woman.
Absolutely. Now that we've now we have some shared language, I'd love to turn toward your personal journey. Can you share how your early experiences with caregiving, chaos, and survival shaped both your healing path and the work you do today?
Yeah. So, I was born to parents who were too young to have children, 18 and 21. And so the real first adult in my life was my grandmother, Millie. And spent a lot of time with her when I was young, watched her taking care of my grandfather, who was a veteran, but also a severely brittle diabetic, so always sick. She worked nights. She took care of him during the day, and just watching just the compassion and how she cared for him and still managed to care for all of us and be there. That's what really started my love of seniors at a very young age. And then fast forward going through some sexual trauma and some physical and neglect and stuff as a child, not feeling like I had a voice. And that not feeling like I had a voice is what really I found to be my connection to those living with dementia, because they often lose their voice, not only physically, but emotionally, and people don't listen to them, that they're not believed, they're not heard, or I see people talk about them while they're in the room as if they're not there. And so really an advocate for to help them find their voice again and to be present and to they're just like us. They're people. They need love. They even if they can't speak, they know how you make them feel. They can feel your heart. They can feel if you're a good person, if you're well-meaning. You don't it doesn't There's a lot of different ways to communicate other than verbal.
Many people think of dementia purely as cognitive decline without understanding what's happening in the nervous system. From your perspective as a nurse, how does understanding the nervous system change the way we understand dementia itself?
Well, I've had a lot of with dementia, sometimes you have to become almost a Sherlock Holmes, an investigator. Like you see what they call, I hate that they call them behaviors, but you'll see something come up, and rather than giving them a new drug to calm them down, let's investigate that. Let's figure out what's going on with them. And oftentimes it's something from their past that they're being triggered by, some sort of, is it PTSD? Is it, there's clients that have had sexual abuse as a child, and it wasn't talked about until there was a situation where we had a male caregiver, and then there was this, they started picking their skin, and there was this change in their behavior and figuring out what it was. And just process of elimination. So even though they may not be able to speak, they still hold all of this inside them, inside their nervous systems, inside their emotional well-being, and it's going to come out. And what behaviors are truly unmet needs. And it's up to us as caregivers to help figure that out. Just like when people say they want to go home, it's not usually that they want to go home. They just want to feel that security that you feel like when you're at home. So whether that's, or sometimes they do remember the home back maybe that they grew up in and they're missing that home. But oftentimes it's because of an unmet need. and making them feel comfortable and at ease and calm.
In your work at Care Matters Always, which I assume is in Westminster, Colorado, what do you see people misunderstand the most about dementia, especially when fear drives care decisions?
I think people try to help them too much. We're supposed to be care partnering, not giving care. We're supposed to be partnering with them and allowing them to do as much as they can do for themselves, and then just partnering with them to do the things that they need help with. So, assuming that they don't know what they're doing or they don't know how to do things anymore, and taking too much away from them and not offering choice and options.
Yes, there's a little bit of breaking up on your end. So if I'm pausing, it's because I'm not sure if you're finished speaking. You speak so powerfully about trauma responses and dementia behaviors that often overlap. Can you help listeners understand how behaviors that look difficult or resistant may actually be expressions of fear, confusion, or nervous system overwhelm?
Yeah, so lots of things, outbursts, slamming doors, yelling, hitting things. Again, it's really about stopping what you're doing, validating what they're feeling, bringing your attention to them, bringing yourself to their level. If they're in a wheelchair or if they're in a chair, I get down on my knee in front of them so that I'm eye to eye. Now, if you don't know this person as well, you may want to keep a safe distance just to make sure you're not going to get injured. But validating how they feel and letting them know, I see you, I hear you, just that alone can go a long way. They just want to be seen and heard, just like all of us do. And sometimes the only way their brain allows them to do that is sometimes in anger, but just validating them. And sometimes even when they're loud, saying, gosh, I understand, being loud back to them, but validating how they're feeling. And then they're kind of looking at you and initially in a little bit of shock, but then they come down because they realize that you are listening to them and you are hearing and seeing them, and that's what they want.
Yeah, and I want to go back just a moment to something you said earlier that I very often tell our, families that work with this population. It's that it's you always want them to do as much as they can do safely. We always want to add safely at the end. You're correct. People assume that, oh, this person has dementia, they can't do anything for themselves. But there's a lot of motor memory things. There's a lot of language things, even that are reading, right? A lot of things that are retained a lot longer than people often realize. So if you can sit with your loved one and you can fold laundry with them, that's going to be better for their overall health and well-being and independence and, feeling like they matter, feeling like they put something in than just doing everything for them. Because when we do everything for them, they lose the ability to do for themselves whatever, what's ever left over at that point. So, how does this understanding shift the way we respond from control to compassion?
Well, going on what you were just saying, I was just thinking about just how they mirror what you do too. So maybe you're trying to get them to brush their teeth. Maybe put the toothpaste on and you start brushing your teeth, then they'll start brushing their teeth. So instead of trying to get in there and brush their teeth for them, mirror it for them so they can see what they're doing, what you're doing. Do you want something to drink? So using hand gestures. Are you hungry? There's a lot of different ways to get them to to do what they can do, and getting their attention. You need to know, can they see you? Because their visual perception changes. Can they hear you? Are you in front of them so that they can see you? Are you in front of them? Because a lot of them lip read. So COVID was awful because we had masks on, so not only couldn't they hear us, but then they couldn't lip read either. Being present, getting that eye contact. And I'm sorry, what was your question? I got on a tangent.
No, no, I love that. It's just regarding trauma, dementias, and behaviors, and how when we're looking at these individuals, shifting our perspective, shifting our mindset from looking at those behaviors as being difficult or resistance, and instead seeing those as signals of the individual. Maybe they are expressions of fear. Maybe it is trauma from before, right? Maybe their nervous system is overwhelmed and we need to modify the environment. And so the question was how that understanding shifts the way we can respond, right? From a place of control, needing to control the situation, to more compassion, meeting them where they are and really understanding who they are.
Well, another thing, truly, I'm reading a book now it's called Generations. And it is just, it's been very eye opening that, you've got boomers versus Gen Zers, and just the way it says that the generation that you grew up has more influence on you than the family you grew up in. So you've got different, you know, maybe a Gen Z taking care of a boomer or a Gen X taking care of a boomer. Well, they're going to see things very, very differently. And having the understanding of what they went through during their generation for me has just been very eye opening and allows me to have that education and then the power to better understand them. But it does take some time to get to know somebody and build that rapport with them. It's not just something that's going to just happen. It's got to be something that you want to do, that you're willing to do, and that you can be present to provide to them.
Many caregivers and clinicians give endlessly, often without realizing their own nervous systems are in survival mode. Why is tending to caregivers' nervous systems not optional but essential for ethical and sustainable care, both for dementia care as well as beyond that?
Well, there's an alarming statistic that 40% of caregivers who take care of those with dementia die before the person they're taking care of. Outside of dementia, it's 30%. So that is a real number. I've seen it myself many, many times where the latest one was a son that had moved in with his mom with dementia and totally neglected his care and wound up dying of a heart attack in the basement. And thank goodness his sister happened to be visiting that weekend so that she was able to find him. Imagine if she wasn't there, here this woman would have been on her own in the house, not even knowing that her son was downstairs dead from a heart attack. So you have got, again, it goes back to filling your cup and taking care of yourself first, going for that walk, doing that meditation, taking that breathing. I mean, everybody has different things that work for them. Hopefully, we're not using drugs and alcohol to think we're helping our nervous system, but doing things that work for you to help calm your nervous system and fill your cup. And it's a daily practice and multiple times a day, depending on the situation. It's very easy to get frustrated when someone is asking you the same question over and over and over again.
What signs do you see when caregivers are nearing collapse, but they haven't recognized it yet?
A lot of times it's just, especially with some of the caregivers and the adult families that I work with, they'll call me very angry and frustrated. I can't do this anymore. I didn't sign up for this. One of the reasons I became a trauma informed clinician as well was because I've had many family members tell me, I have to take care of somebody that never took care of me. There's a lot of resentment there too. So really helping to support them so that they can take care of their loved one who desperately needs them. So anger, they will sometimes stop taking care of their own hygiene. Maybe they're not eating. They're just taking, you notice and they're losing weight or they're gaining weight in the same clothes that you've seen them in multiple times. Their hair's not brushed. Bills aren't being paid for themselves. There's lots of different flags that you can see. And some of them, quite honestly, you can see them almost aging right in front of you just from this event that they're going through, taking care of their loved one.
You
And
said
that
something so
hopeless.
important, that healing doesn't Yes. You said something important that healing doesn't mean erasing the past, but creating safety, regulation, and choice in the present. What does that shift look like in real life, especially for caregivers or family members who feel overwhelmed, exhausted, or grieving someone who is still physically here?
I think that's one of the hardest things is that anticipatory grief and grieving someone that is right here next to you. Asking for help, that neighbor that keeps asking what they can do, give them something to do. Maybe pick up groceries for you so you don't have to go do it. Maybe, mow the lawn for me. People don't know what to do. And I know it's overwhelming. Sometimes it feels like another thing on your plate when they say, let me know if you need something. I prefer personally to say, you know what, I'm going to go grab some groceries for you. What would you like? But taking advantage of those people from church that want to bring the meals, let them bring the meals. You do not have to take this all on yourself. And, this comes up a lot with siblings that, siblings aren't doing their part. I think it's really important to sit down. Maybe they can't be here physically, but maybe financially they can help support. Maybe they can buy the monthly groceries or they can pay for a caregiver so you can get some respite. There's support groups, there's adult daycare. There's a lot of resources out there, but you've got to be willing to ask for help. And that's not weakness. That's not weakness at all. This is not a journey that anybody is meant to do alone.
It really does take a village, and that's just not raising children, is it? It's also in the
Oh,
context of caregiving as well. It definitely it takes a lot more than just one person. And I know that we're kind of raised, right, Kimberly? Aren't we kind of raised to I have to do it all myself. I have to be Miss Independent or Mr. Independent. But we come across these times in our lives where it's really in your face, isn't it? That we can't do it all by ourselves. We can't do these things alone. And so that's absolutely an invitation for all of our listeners out there to reach out and to ask for help. Kimberly, here on NeuroAlchemy, we like to do something called Challenge of the Week. So for our listeners who want to try something tangible to work with, what's one simple awareness or practice you'd invite them to explore over the next week to support compassion, regulation, or presence, either for themselves or someone they care for?
something that I was brought to my attention that I try to do, challenge that I would like to see here in Denver. We do have quite a bit. We have a large homeless population. And I would just ask that if you're presented with somebody that's homeless, or give them eye contact, give them a smile, see them, know that they're there. It doesn't mean you have to give them money. You don't have to give them anything, but let them know that are seen. I mean, I have just started this practice, and the smile that I get back from people, nobody wants to be in that position. And a lot of these people are suffering from dementia or from mental illness. And that's why they're in this position to begin with. So I think to just show empathy and compassion, just instead of, hiding away in your car so they don't bother you, just lifting your head and giving them a smile. It doesn't cost you anything, but I'm telling you what, it's going to make a difference in their day, and it's going to make you feel better about yourself as well.
That's really beautiful. Thank you for sharing that. So, for all of our listeners out there, I want you to give that a try if you feel moved to do so over the next week. And let us know in the comments how it went. As we begin to close, Kimberly, what do you most hope listeners walk away with understanding about dementia, their nervous system, and their own capacity to care with both strength and gentleness?
To give yourself grace, to know that you're doing the best that you can. Some days or some moments are going to be better than others. You can't nail it all the time, but to just give yourself some grace and take a deep breath if you're feeling overwhelmed, and don't be ashamed to ask for help, because you shouldn't do this alone.
I love what you said there, that we're all doing the best we can. And, we absolutely are. If any one of us at any moment in time could be doing better than we are right at that moment, we all absolutely would be. And so give yourself that grace, everyone. Kimberly, thank you so much for this grounded, compassionate, and deeply human conversation. Thank you to everyone listening to this episode of NeuroAlchemy, where the nervous system, embodiment, and multidimensional healing meet. If something you heard today was helpful for you, or you think it could support a friend, a family member, or a colleague, please take a minute to like, subscribe, and share this episode. It truly helps these conversations reach the people who need to hear them the most. Until next time, take gentle care of your mind, your body, and your inner world. Bye, everyone.